So hopefully on your screen you can see Genomics, Human Research Ethics Committees, and Waivers of Consent, as well as my name. Thank you so much for being here. I'm Lyndsay, and as Hudson said, I'm a research fellow at the Australian National University within the National Centre for Indigenous Genomics. So it is a bit of a mouthful. Look, firstly, I'd just like to acknowledge the custodians of the lands on which I'm presenting to you from today, the Ngunnawal and Ngambri peoples, and I'd like to pay my respects to their communities and to their elders past and present. And I'd also just like to acknowledge and pay my respect to the peoples whose lands you are all on, and to any Indigenous peoples who are sharing this online space and time with me. So while I'm now based at ANU, most of my 8 years in academia have been spent at the University of Tasmania. And today I'm going to be talking about some research that I helped undertake while I was at this institution. At the time, I was working as a research fellow within the Centre for Law and Genetics, within the Faculty of Law at UTAS, although my background is in sociology. I was heavily involved in this study, but it was led by Professor Di Nicol, and it couldn't have happened without the input from Associate Professor Beck McWhirter, Dr. Lisa Eckstein, and PhD candidate Vanessa Warren. And I just also want to acknowledge Professor Christine Critchley here, as well as Swinburne University researcher Jared Walsh, whose earlier work and study really paved the way for this one. And it's important to add that this study was funded and made possible by the Australian Research Council. With this study, we sought to examine the level of trust that members of the Australian public have in relation to human research ethics committees, or HRECs, within the context of genomic data sharing. And just in case you're not sure, human research ethics committees are what we call institutional review boards or ethics committees in Australia. And I'll be referring to them as HRECs throughout the presentation, just to make it a little bit less wordy. So with this study, we were interested in how people felt about aspects of HREC composition and whether the attributes of the people who tend to or who potentially make up ethics committees could promote trust in these entities. And we were also interested in how people felt about certain aspects of HREC decision-making, particularly whether people trusted HRECs to make decisions about their data without their express consent, and what mechanisms could maybe help with this. And the reason that that point relating to decision-making is bolded on the slide is because this is the component of the study that this presentation is centered around. And I chose to do this because we recently submitted a paper that focuses on this too. We developed and undertook this study for a few reasons. Obviously, funding had been secured for it, but the impetus for the study was a consequence of themes that emerged from the literature and from previous research that was carried out by more senior members of the research team. I think these themes can really be distilled into three overarching reasons for the study, and they are firstly, the establishment of the field of genomics, secondly, the role that HRECs have in this field of research in the context of Australia, and thirdly, the kind of decision-making that HRECs are, at least in part, responsible for that is critical for genomics and certain genomic practices, again, in Australia. I wasn't entirely sure what attendees' knowledge would be with respect to the emergence and growth of genomics. As I mentioned, my background's in sociology, so it's very possible that you have a much more in-depth understanding of genomics and how genomics works than I do. But if you're also still learning like me, genomics is a relatively new field of research that involves the study of genes, gene function, and the influence of environmental factors on genes and gene function. And genomics receives quite a bit of attention because it's considered to have the potential to be of great benefit to us, particularly in relation to medicine and healthcare, with the field of research believed to, again, have the potential to bring about knowledge that can help prevent and treat illness. Additionally, outside of medical settings, genomics is sometimes affiliated with the bringing together of families and with people's ability to learn more about who they are and maybe also where they come from. Still, while these outcomes may be beneficial to some people, genomics raises many logistical and ethical issues, as well as social, cultural, and legal issues. A lot of these issues appear to be associated with the very personal and unique nature of genomic data. The fact that because it is so personal, it is re-identifiable in ways that other kinds of data like interview data or survey data are just not. And not only this, but the fact that despite being personal, it's also shared. So if genomic data is used in a study, the information obtained in relation to a person's data will tell the researchers things about that person, but also that person's family. Because of this, studies that involve genomic data exacerbate some of the risks that exist in relation to all research. For example, the risks that come with maintaining privacy and confidentiality. At the same time, the nature of genomic data and genomics means this field of research brings new risks. So for example, because of the information that can be obtained from conducting analyses in relation to genomic data, researchers can sometimes find out things about a person and that person's family that they weren't expecting to. And depending on the nature of these findings, it can be difficult for researchers to know how, but also whether to share these findings with participants. In saying this, a lot of the challenges that come with genomics are actually to do with the practices that to an extent underpin and drive the field. And the one that we were really interested in for the purposes of this study was the practice of genomic data sharing, which involves researchers or institutions making the data that they have collected available to other people, mostly for use in research. The opportunities, challenges, and practices that genomics brings impacts all of us, or has the potential to. But it's clear that these things really have the potential to impact the frameworks that guide how research is undertaken. As I've mentioned, in this study, we chose to focus on the Australian context, and in Australia, HRECs are key players in research governance frameworks. Last time I checked, there are about 200 HRECs in Australia. I hope this is still the case. And while there may be a little variation in terms of the number of people that comprise committees and the kinds of people that comprise these committees, there are requirements set by the National Health and Medical Research Council that ensure a level of consistency across HREC composition. At least that's my understanding. So when it comes to genomics, HRECs are the entities that typically examine researchers' study proposals and that need to approve these proposals in order for research to commence. I'm sure I probably don't need to highlight any of this, but HRECs, particularly given Dr. McWhirter and Dr. Labloy's presentations, but HRECs are guided in their decision-making by laws and by requirements outlined in the National Statement. I know that there's an updated version of the National Statement that will soon come into effect, or that may already be in effect in some places, but because our research was undertaken in 2021, we utilised the 2018 version, and I've made reference to that here. It's also important to note that depending on the studies that are being reviewed, as Beck said, HRECs may utilise additional guidelines when reviewing. So there appear to be many layers to HREC decision-making, but with this study, we were focused on a particular aspect, and that was how committees made decisions in relation to waivers of consent. In other words, how committees decide whether a researcher or a research team can be permitted to utilise data without asking permission from the people who donate it. So on this slide are the criteria that HRECs in Australia use to decide whether a waiver can be granted. In the 2018 National Statement, I believe these appear in Chapter 2.3, and I also believe these criteria relate to and are used in relation to most kinds of research, but they're not used to assess research that involves genomic data. Instead, the following criteria are used. These criteria can be found in Chapter 3.3 of the 2018 National Statement. And if you're not familiar with these criteria, it probably feels a little like I've just whizzed through the two previous slides, but this slide provides a little bit of a comparison. So on the left, I hope I'm pointing the right way if you can see me, but on the left, we have criteria that are used by HRECs in the assessment of most research. And then on the right, we have the criteria that are used by HRECs in relation to genomics research. And as you can see, there are some differences, not just with respect to the number of criteria, but also with respect to the kind of criteria. So, for example, biomedical principles such as beneficence and justice are pretty evident in the criteria to the left, but maybe not so evident with respect to the criteria used for the purposes of genomics research. And I'm sure there are many good reasons for this and well thought out reasons for this and for these criteria distinctions, but we were really interested in seeing how people felt about the criteria on the left, the criteria that are used more generally in research within the context of genomics. So to investigate how people might feel about HRECs making decisions about their data without their express consent, we drew on the criteria that HRECs use when granting waivers to generate circumstances that we felt our study participants would be able to reflect on, and they're listed on the slide. And as you'll see, and as I mentioned, we use the criteria that are not currently utilised by HRECs when undertaking decision-making in relation to genomics. And just on the right-hand side of the slide, you'll see that we also added a few circumstances that are less easily linked to the criteria, such as the ability to opt out, which is another approach to consent that can occur in research that doesn't involve genomic data. So we explore these circumstances and HREC decision-making by conducting an online survey with the help of the Qualtrics XM platform. The survey had 22 questions. Almost all were closed-ended. So for the most part, statistical analysis was undertaken in relation to the data collected, and the results that I'm sharing with you today, or that I will be sharing, pertain to this analysis. The survey also had a between groups design, which means that the way it played out differed slightly for different respondent groups. And it differed insofar as before answering questions relating to HREC knowledge and views, respondents were allocated one of 3 genomic data sharing scenarios to read through and to hopefully think about while they answered the remainder of the survey questions. The purpose of this slide is to give you a bit of an indication of the 3 scenarios that were used in the survey. These scenarios came about as a consequence of another related study that was undertaken by members of the research team. Basically, the scenarios depict how data sharing or genomic data sharing can play out. And we chose to utilize these 3 scenarios because they had attributes that were different, and because different members of the research team were particularly interested in some of these attributes. Furthermore, another, again, related study also utilised these scenarios in the same way and for the same reasons. I just quickly wanted to also mention why we chose to focus on trust, and this was a little bit of a later addition to this presentation. Unsurprisingly, there were a few reasons, but we were interested because trust is so important to genomics and has been shown to influence, again, perhaps unsurprisingly, people's views on genomic data sharing and storage. And we were also interested because of the relationship that is thought by some scholars to exist between trust in research and ethics committees, and how committees can shape that trust. And I've also just included here the definition of trust that we utilised in the survey, just on the bottom right-hand side of the slide. I hope that it's not being obscured or obstructed, I should say. And this slide just gives you a bit of insight in relation to who our survey respondents were. So our sample comprised 3,013 people from all Australian states and territories. We used quota sampling in our recruitment, and because we worked with Qualtrics XM to recruit respondents, it was possible for us to invite a certain number of people from certain jurisdictions throughout Australia to participate in the survey. And so this meant we were able to have a sample that was somewhat representative of the Australian population in terms of geographical location, age, and gender. Just checking how I'm going for time. Okay, so now I'm just going to run through some of the results with you. So as I've mentioned, and I've hopefully made clear, we wanted to explore a lot of criteria and circumstances. And this makes it kind of hard to present results in a way that is both clear and visually appealing. Normally, I'd present this kind of information in a table, but tables aren't always popular presentation tools, and I've already used one. The blue rectangles here show the proportion of respondents that indicated they would trust HREC to make a decision about the future use of their data. The orange or the yellowy rectangles show the proportion of respondents that would not trust HREC to make a decision on their behalf. Down the right-hand side, we have the circumstance types that respondents were responding to, and down the bottom, we have an indication of the percentages. So we can see from this figure that there's quite a bit of variation. While all circumstance types are supported by a proportion of respondents, none appear to be especially conducive to public trust. In saying this, there are some that have definitely received more support from our sample than others. And I've tried to highlight these here. So almost around or over half of our respondents said that they would trust HREC to make a decision about the use of their data without their express consent in these 4 circumstances. I'm going to talk a bit about benefits and privacy in the next 2 slides, but I just wanted to highlight that almost half of our respondents, specifically 45.4%, reported that they would be comfortable with the HREC making this kind of decision if they had the ability to opt out. And this is interesting, and I'm just flagging this because at the time of the study, this approach to consent was not an option in genomics research in Australia. But with the updated version of the national statement, that this may no longer be the case. The circumstance type that received the most support from our respondents concerned future research benefits. So if the future research was beneficial, respondents said that they were happy for HRECs to make decisions about their data without their express consent. And even though there was endorsement amongst all respondents, a binary logistic regression showed that older respondents were significantly more likely than those younger to feel this way. Evidently, our results highlighted support for HREC decision-making in the instances that future research was beneficial. However, almost as many respondents reported that they would trust HREC with decision-making if they could be confident their privacy would be protected. With respect to this circumstance type, in addition to age, gender and education were also significantly associated with respondent views, with men and those respondents without a tertiary education significantly less likely to feel this way. Because of the categories that I used as the baselines in the regressions that I ran, this sounds a bit weird. Like surely confidence in privacy protections would promote trust. And because this is a survey, it's hard to know why people responded in this way, but this kind of response could tell us, for example, in relation to gender, that in comparison to women, men have more trust in HRECs, so they don't feel a need to feel confident that their privacy will be protected because there's already that trust there. At the same time, this result could suggest that the exact opposite. It could mean that in comparison to women, men have less trust in HRECs and they don't feel it would be possible to be confident that their privacy would be protected no matter what. So this result in particular shows you not only what we found, but the kind of questions that we still have and that we now have as a result. While there were circumstances that were supported, some stood out as being less conducive to trust. Around a third of respondents reported that they would trust a HREC with decision-making around their data if the future project was classified as low risk, or if they could be sure they wouldn't lose any financial benefits. And just over a quarter said they would trust a HREC if people like them had been asked about the research in question and if they thought it was reasonable. Even fewer indicated that they would trust a HREC to determine future data use if obtaining their consent was impractical, or if the HREC thought they were likely to have consented if asked. With respect to these two circumstances, we saw some interesting relationships between not only respondent attributes and trust, but the scenario that was viewed and trust. So in comparison to respondents that viewed scenario 1, that was the scenario involving patient data. Those that viewed scenario 2, which pertained to Aboriginal and Torres Strait Islander people's data, expressed that they would be more likely to trust a HREC to decide whether data could be used without express consent if obtaining their consent was impractical, or if the HREC thought that consent was likely. Now, again, we can't know exactly why this was the case, but in this scenario, respondents were explicitly told that consent would be difficult because the study was conducted some time ago in 2013 and participants were older and may no longer be living. So this aspect of this specific scenario in comparison to scenario 1 could explain the relationship and the association that we're seeing here. Overall, the results highlight the variation that exists when it comes to the circumstances in which people may be comfortable with HRECs or trust HRECs making decisions about their data. But evidently, there's at least some support for the use of all these criteria in HREC decision-making within the context of genomics, particularly those criteria concerning research benefits and privacy protections. Finally, it's clear that the views people have in relation to HREC decision-making are influenced by and likely depend on their attributes and social groupings. And as a sociologist, I'm not super surprised by this, but it's still interesting. So when we're thinking about these results, it's important that the limitations of the study are recognised and thought about. I've tried to, I guess, allude to some of these points throughout the presentation, but it's important to remind you that surveys only provide a record of views at a certain point of time. It's possible that if we surveyed the same people months later or even days later, their responses could change. And furthermore, it's useful to remember that we're talking about complex processes and systems that people may not always think about, and trying to condense these into a short 15 to 30-minute survey. Also, with this method, we're relying on respondents being able to read and interpret content and questions. So it leaves room for gaps. It leaves room for gaps in understanding, and it means people may not always be carefully responding or might be responding in ways they think that they should. In addition to the use of the survey method, our results are somewhat limited by the non-probability sampling strategy that we utilised and also the recruitment method we engaged. While results are not generalisable for those reasons, they do encourage us to reflect on and to think about how waiver requirements are being developed and put into practice in Australia. Additionally, the results show how public trust can be used to justify the use of some criteria, but maybe not so much others, and in this way may encourage us to consider other factors, as well as trust like respect for autonomy. Finally, some results may be understood to highlight the role that greater understanding of the research process could have in relation to public views on and trust in HRECs. And that's the end. Thank you so much.
Thank you, Dr. Newett. And when we get off this, you're going to want to peruse the chat conversation, which has been quite vibrant and lively while you've been on. I don't have any questions that have come forward for you. Gordon, do you have anything?
No, nothing has come forward, but Lyndsay, thanks a lot for that. Look, just in terms of a waiver of consent and 2.3.10 or whatever it is now, there's obviously the one that the requirement that the ethics committee has to consider whether there's any reason anyone might have said no. So, that's a pretty subjective one. How do you get over that? I mean, how do you, first of all, what do you think about that criteria yourself? Is it something that's really, can we ever really say that no one would have said no? And how did that figure in your survey?
Well, yeah, no, that's a good question. And I don't feel like I'm the best person to answer this or respond, or that I have the answer. But I suppose I think that that's so right. So much of the national statement does seem like it's very subjective, and depending on the people who are making the decisions could be interpreted in different ways. But I mean, I think that there are measures that could be put in place that could on consent forms and information sheets that could, I suppose, make ethics committees a bit more certain. So for instance, and I guess maybe this is already happening, but if institutions and researchers were, I guess, given perhaps maybe a bit more guidance from ethics committees on the kinds of things they should be putting in consent forms and in information sheets, because at the moment, I think, I mean, this is my experience and I don't have that much experience, but when I put together an information sheet or a consent form, it's generally based on the institution that I've been working for. And there are some, slightly different, I guess, variations, but definitely at the centre I'm working for now, there's a lot of focus on making sure that any sort of future use of data is, I guess, discussed at that point of data collection. And yeah, so I think there are definitely ways where ethics committees could be a bit more confident that maybe people wouldn't say no if the researchers could say, well, we're going to, check that. But maybe that's not answering your question. And I've just gone off on a tangent. So sorry.
No, it's okay. I mean, it's two separate sort of issues, isn't it? One is future use of data where you are actually, you obtain consent, valid consent by virtue of providing sufficient information. The other is a retrospective agreement by the ethics committee, and who have to weigh up the probability, I suppose it is, and the balance of probability. We believe that most people would have said yes, even though that's not what the national statement says. So I think it's a really difficult one. And I think, the results from your study sort of suggest that, well, it's hard to sort of interpret them totally, but sometimes people just don't necessarily know what they're being asked, I guess.
Yeah, I mean, I think ethics committees do a really good job, and
I'm glad you said
probably
that.
You definitely have people saying yes. They, most people would have said yes, but I think I would find it impossible if I was on an ethics committee to say that, people would have consented if asked. I think I would struggle with making that decision, because I just do feel like it's quite subjective. So yes, my personal
just a comment from Suzanne Nash. I recently got my hospital records following surgery and noted I ticked no to consent to the use of my data for research just because the wording was too wide. I wonder how they removed my data though. How would I know if they just used it anyway? Great point, Suzanne, actually. I don't know. You've got to trust them, Suzanne. That's how. You've got to trust them.
And generalizing that, how do we know that the applications we approve abide by our conditions that we've set?
That's true, Hudson. Monitoring by an annual report is not really sufficient, is it? I think we would all agree. Just looking through, I can't see any more questions here.
And the sidebar chat is still going on. This is the vibrant chat line I've seen in any presentation. So
yeah, you've stimulated
through it all.
Stimulated a lot of chat there, Lyndsay. Well done for that.